Well, good morning, everyone, and welcome. Welcome to the launch of this Itasca Housing Affordability Dashboard. We're pleased to be joined by so many of you this frigid Minnesota morning, and we're about to heat it up for everyone with some exciting information. My name is Colin Barr. I'm the Division President of Ryan Companies, and I'm one of the co-chairs of Itasca's Affordability Housing Task Force. We launched this task force back in 2019, right on the heels of the governor's statewide housing task force. In doing so, we came up with 3 recommendations, and one of them is what we'll be talking about today, which is creating this new dashboard. In this regard, Itasca partnered with the Federal Reserve Bank of Minneapolis to create this tool that we're talking about today, and we want to greatly thank them for their time, their expertise, their dedication to the work, and just all the great work they did around this to get to this point. And now I'd like to hand this off to my co-chair, the distinguished Ron Feldman, who is Chief Operations Officer of the Federal Reserve Bank of Minneapolis, to walk us through this new dashboard. Ron?
Thanks, Colin. And I want to thank Colin and everyone at Ryan for their support of the effort. And I think if folks don't know, the Itasca Project is a volunteer group of folks from nonprofits and government and the corporate sector. And the work that you're seeing today reflects lots of input from many, many individuals. And so I want to thank all of them for that. So as Colin said, we put out this report on affordability, following up some of the work of a governor's task force. And it's a really complicated problem to think about affordability of housing. But if we had to distill it down to a couple of ideas, the key ones are that we need more production of housing in our area to have an area that's equitable and to try to get housing prices under control. And we're talking about rental housing and owner-occupied housing. But that's the key thing. We need more supply. From the private sector in particular. That's where it's going to come from. And why, again, is that so important? It's really about the economic vitality of the region. As Colin said, it's really cold today. And one of the ways that shows up is sometimes folks don't want to move here. Sometimes folks think about going someplace else where there's more amenities. But the fact that we've had an affordable housing stock what's relatively cheap compared to the other places people can live has been something that's attracted people to stay here. And if we lose that advantage, well, then we're going to be a place that looks less attractive to employees, employers, et cetera. And the other part that's really critical is the issue of equity. We've got some really, really serious problems across many, many parts of the Twin Cities and the region, but in particular around housing. If you look, for example, at the home ownership gap between Blacks and whites, it's the worst among really almost any metro area. And if we don't get more housing supply, if we can't fix issues around equity, again, that's going to be a huge drag on our economy. People are not going to want to be and to move to and stay in an area where there's huge equity problems and where housing is just not affordable. And again, it's clearly a more subtle issue in many regards, but those are really the key points that we're focused on. We want to keep the area competitive, and to do so, we need to ensure that we've got an equitable and affordable housing stock. So we made 3 recommendations, and we can move to the next slide. There were many, many ways we can tackle this problem, and many groups in the Twin Cities and the state are really going after the affordability problem. We're focused on just 3 areas. The one we're going to talk about today is this affordability dashboard, so I'll come to that in a second. There's 2 other ones I'll just mention briefly. Colin is heading up an effort to try to think about how can we actually produce housing in a lower cost way. And then the third option we're looking at is how can employers in the region help support housing through some of the benefits they offer. I think many of us have heard and seen surveys that even a small financial hit to a household, if people had a $400 unexpected cost, it would really put them into a spiral, which sometimes leads to things like getting evicted, not staying current on their payments on their house. And so if employers can provide financial support through things like, for example, lines of credit, that might be something that would keep people in housing and make housing more stable. So more to come on that. So let's talk about the dashboard. I think a reasonable question could be, do we need more data on this? Don't we really already know what the problem is? Why do we need another dashboard? Well, we need another dashboard, and we need this dashboard in particular for 3 reasons. I think the most important, and we'll talk about this in a second, specifics, is we are setting, as a collective, the Itasca group is setting 3 goals for 3 of these metrics. So it's not just tracking the data, it's saying, it's not just where we've been, it's not just sort of a real-time snapshot, it's where we need to be. That's key. So we need to put a stake in the ground and say, this is what we need to do as a region, and all of us need to come together and do that. There's lots of data. And then the third part that I think distinguishes us, and I sort of said this, there's a competitive issue here. People have lots of choice on where they want to live. I think we've seen that with people having greater flexibility of where they work from. We want this area to be a vital area with economic growth. And to do that, we need to compare what we're doing to other areas where people are going to be. So let's talk a little bit more about the dashboard itself, and we can move to the next slide. We're not going to go through all of it, but I want to hit some of the key parts, particularly focusing on the goals. And then we'll turn it over to our panel. We've got a really great group of panelists today, and I think we should spend as much time as we can listening to them. So there are 3 goals that we've articulated as a group. The first relates to, as I said, housing supply is really the key. We need more housing. There's been a lot of discussion over the last several years about the importance of existing affordable housing, sometimes what people call naturally occurring affordable housing. And I think it's interesting that the only way you get more naturally occurring affordable housing in the future is by building more housing today. To use the old cliche, the best time to plant a tree is 5 years ago. The second best time is today. I mean, we need to get more housing produced today so that in the future, we've got more housing that's more affordable to more people. So what we've done is we've articulated a goal for housing production. And I want to be clear, all of these things are kind of subjective. We're putting the goal at roughly 18,000 new units a year. Where does that come from? Why 18,000? Again, I wouldn't get caught up in the exact number. The key part is that we need a lot more we need today, in part to make up for the fact that during the Great Recession, there was a huge reduction in the amount of production. So we need to make up for that. And then we need a buffer on top of that to try to get prices down. So we're going to be tracking how we're doing against this goal. You can see over the last couple of years, we've done better, but that's not going to be enough because this is a multi-year goal where we need to look out 10 years to get production up. The second goal relates to not just the total production, but specifically around the production of heavily subsidized units. Why is that important? There are some parts of the housing market where the private sector is not going to be able to produce units that are affordable to households who are at very low incomes. It's just not going to be possible. That's not really a role we would expect the private sector to play. Now, certainly producing more housing makes more housing cheaper for everybody, but we also need targeted, heavily subsidized housing for those families and households who otherwise will not be able to have access to it. But thankfully, we've got Charlie Zelle here today, chair of the Met Council. The Met Council does a fantastic job trying to articulate and estimating how much of that affordable housing should be produced. And so we're just piggybacking on their great efforts and saying and tracking, are we producing the amount of affordable housing that's heavily subsidized? That's what we mean by that term. And we'll be working with the Met Council on that. And then finally, before I turn over to give a little more detail on the goals, the final goal is this issue related to equity. And there's lots of different ways we could talk about how we could try to achieve greater equity in the Twin Cities. And again, I want to reiterate, this is all about the Twin Cities and the metro area and the state being competitive. So there's moral reasons why we need, historical reasons why we need more equity, but we also need it to be competitive because this is where people want to live, as a place where there's equal opportunity for everyone. So if you look at the homeownership rate, we've talked about how the homeownership gap between blacks and whites in the region is really horribly inequitable. The gap is too big. And what our goal is to have the Black home ownership rate in the region be the same as it is for the nation. And actually, that might sound like settling. That might sound like not a bold goal. In fact, it's almost a doubling of where we're at today. So it's a huge change, and it's going to be critical. I think we all know that a home is really the biggest asset that most households have. So it's not just a question of home ownership per se, it's also wealth building, and it's putting this community in a place where it needs to be to make sure that everyone here has access to the same opportunities. So those are the three goals. Let me repeat: more housing supply, more targeted subsidized housing, and more reducing the gap between white and Black home ownership. And then finally, let me just give you a flavor for what the rest of the dashboard looks like. It's got so much data, not a good use of time for us today to try to walk through all of it, but just want to give you a flavor for what's here. You're going to see data on where things are over time. You're going to see, as you move down a little bit, that you can look at things spatially. So that's the next section. This is going to be true for all the metrics, so you can see what's going on. And then, as I mentioned, we're going to be able to compare our MSA to, frankly, areas that people are thinking about we're moving to when they're not thinking about moving here, or places that people might go. So that just gives you a flavor. I would encourage you to explore the dashboard, give us feedback on the dashboard. We'll improve it over time. But for now, we think the setting of the goals, the comparison with other regions, and just the depth of data we have is going to separate this from other tools that we all have to try to figure out how we can get more affordability. So that's the introduction. With that, I want to turn it over to Stephanie Brown, who's the Executive Director at the Urban Land Institute here. Stephanie is a real housing expert. We're really pleased that she would be able to moderate the panel. And with that, let me turn it over to Stephanie, and so we can hear from the great group of panelists we put together today.
Thank you, Ron. So let's go ahead and dig into this discussion. I'll introduce our panelists briefly. I'm joined by Tom Wind, the Executive Vice President of Consumer Lending with U.S. Bank, with Paul Williams, the President of Project Pride and Living, Charlie Zelle, the Chair of the Met Council, and Dr. Shaun Frost, the Associate Medical Director for Care Delivery with HealthPartners. I'll let them all introduce themselves in a little more depth. We're going to start with a few questions, but you all should feel free to add questions. There's a Q&A feature, either questions for our panelists or questions on the dashboard. We have Julia Silvas, the Director of the Itasca Project, and Libby Starling, the Director of Community Engagement at the Fed, both of whom were very tightly involved in the development of this dashboard, and they can answer further questions on some of that data or the features. So put any of those sorts of questions in the chat feature. So we want to start off, and Paul, I'm going to go to you first. Just a quick introduction and of yourself, and then how does this relate to your work? As you look at these goals, how would your organization use this? How do you think about this? Obviously, we've got a lot of folks who have some interest in housing if they join a housing dashboard conversation, but you all come at this from different angles. So if you can pull some of that out, that'd be great. We'll start with Paul.
Great, thanks, Stephanie, and thanks everyone for being here today. Very excited. I was part of the working group with Itasca that helped come up with these recommendations, and was part of Governor Dayton's original housing task force. So I'm the president and CEO at Project Pride and Living, a large nonprofit community development organization here in the Twin Cities. We own and manage about 1,600 units of housing, so about 3,500 folks live with us every night. Vast majority of those folks are lower income folks of color, and about half of our portfolio is heavily subsidized, very low income, what we call supportive housing. So kind of deeply affordable, deeply subsidized kind of services that are targeted to folks, many of whom are coming out of the shelter system. The other half of our portfolio really is what we call workforce housing. Family of four earning, $40,000-$45,000 a year, not necessarily a dedicated service component, but worker bee folks, who are kind of one crisis away from falling back into some real difficulties. So we've been around for about, this is our 50th year actually. The dashboard for us, one, especially for my board, in terms of having kind of credible, objective, private sector based data and information and trend information is actually really helpful for my board to be able to say, yeah, we understand the direction that we're going. We understand where our goals are as an organization and kind of how we fit into kind of the larger continuum of developers throughout the Twin Cities, both nonprofit as well as private. So great to be here today. Thanks.
So Charlie.
Hi, everyone. Charlie Zelle, and I am the chair of the Met Council. And as Ron has pointed out in the introduction, the Metropolitan Council is deeply engaged in housing issues. You know, we're fundamentally a planning agency, and we're actually now just initiating another 10-year cycle of planning with goals that are part of those plans. We look at a lot of different issues, but housing is a big one. And you think about the 180 separate municipalities that make up our 7-county area, you know, and many housing policies are really determined by local government. How we get a regional plan out of all these separate entities takes coordination, but also requires a deep understanding of where the benefits are. And, you know, housing choice throughout the metro is really what we aspire to have a resilient and a prosperous region. And, you know, and I just really appreciate the development of this dashboard, the work Paul and others, Ron, have had in developing some kind of goals, goes beyond the metropolitan goals. This is ones that are deeply shared. And I think that it is kind of helpful for us, the Metropolitan Council, as we work toward developing a regional plan, having a kind of a dashboard as a sounding board really helps us get more aligned interests. You know, and I think the biggest challenge we see, we're also the largest housing authority, so we actually manage units, we manage vouchers. And we see the biggest disconnect is that deeply affordable and the heavily subsidized units. That's the biggest mismatch in terms of supply and demand, and because of lack of capital and the amount of subsidy it requires. And so, you know, getting it out on paper and getting it understood as to kind of what the levers are needed, both at the local, state, and federal level to help support deeply affordable housing is really paramount. And I think this dashboard gives it a higher profile, a deeper understanding. I should also just do a quick shout out to my boss, Governor Walz, who yesterday just proposed $450 million of housing. So, you know, it's not enough, but it is a lot. And I think we are recognizing the housing crisis almost starts at the bottom. Thanks. Good to be here.
Tom?
Yeah, hi. Thanks, Stephanie, and appreciate the opportunity to join the group here. Stephanie said I manage consumer lending at U.S. Bank, so that covers the mortgage business, which we're one of the top lenders in the country, as well as auto finance, home equity lending, and personal loans. And so having the opportunity to see the dashboard was fantastic. In full disclosure, I'm one of the, I guess, outsiders on the group because I don't actually live in Minneapolis. I live in St. Louis. But of course, Minneapolis is, you know, home to U.S. Bank and in one of our most important markets. And so seeing the dashboard, I thought was fantastic. I got this idea, how do we take this to other areas? You know, as a lender, we're always, you know, trying to really understand the health and vibrancy of the market. And what I really liked on the dashboard is starting with those goals, but then the ability to really dive down into the details and see things like, you know, the geographic breakouts or how you compare, you know, to other markets is just really helpful information that we can use and our team can use in Minneapolis to help kind of direct our efforts. So you know, I think it's a fantastic effort and really excited to be here with you today and speak to it.
Dr. Frost.
Yes, good morning, everybody. My name is Shaun Frost. I work as a medical director at HealthPartners Health Insurance Plan in Bloomington, and I'm also a physician at Regents Hospital in St. Paul, where I practice hospital-based internal medicine. And the subject of housing affordability is of interest to me in both of these professional roles that I have. In my work as a care provider, I frequently take care of patients who are challenged by homelessness and housing instability, which unfortunately directly negatively affects their health and their well-being. And then in my role at the health insurance plan, I'm involved in the development of novel healthcare initiatives to identify and remedy health-related social risk factors and health-related social needs, of which housing instability is a top priority. And what I found particularly intriguing in the dashboard was the disaggregated data illustrating the differential impact of housing affordability according to race. I think this information combined with the dashboard's county-specific data might help healthcare organizations such as mine to identify specific populations that would benefit most from our efforts to eliminate healthcare inequities and healthcare disparities.
All right, thanks to all of you. I'm going to start with Paul again. Paul, can you talk a little bit about these goals? When Ron introduced the dashboard, he talked about where we're meeting them and where we've been failing them in the past. Do the current tools we have work? You're making decisions for your organization. Can we get there with what we're doing? Or does this take something fundamentally new?
Well, I think the tools that we have do work. I think part of our problem is an issue of scale, as well as kind of an issue of several of the other factors that are kind of driving production. So I actually, in the Twin Cities and in Minnesota, we have one of the more productive nonprofit subsidized affordable housing industries actually in the country. When you think of Common Bond and Aon and Beacon and PPL, I mean, really good group of folks doing good work. And we in fact even have some private developers who are doing work at the kind of the margins, more the 50, 60 to 80% in the NOAA types of housing units. That's all valuable. The problem is we are well below scale, and we've been losing ground over time. So we knew early on in our discussions in the governor's task force that we desperately need the private sector to get more into this work, and we need to significantly scale up the tools that we have. And in fact, as we talked about in the Itasca report, we need to innovate as well and find new and different tools. So I'm really intrigued, for example, by some of the work that's being done on much smaller scale housing units, where you know, and this is kind of thinking back the past. 1950, I think the average square foot size of a typical household was maybe 1,300 square feet for a family, a solid family of four. Our family size has declined over the decades, and now we are up to an average square footage household size of about 2,300 square feet. So the houses have gotten bigger, the families have gotten smaller, or the households have gotten smaller. And that's just one example where I think we've got kind of this mismatch. And so more resources for sure are needed to scale up, but I also think we need some different strategies and some different players and developers kind of all coming in to respond to this.
Building on that point about mismatch, there was a comment in the chat about sort of how different people who are most in need of housing are having the chance to share their perspectives and really lead and influence this work. Commissioner Chair Zelle, as the leader of this planning agency, what are the different ways that the opinions and perspectives of the people who most need the housing are shaping the decisions that are being made?
Well, first of all, it is, we are short of overall supplies. There's no question. But it's curious we have a 70% of Minnesotans own their own home, which is one of the highest in the nation. The issue is those that are cost burdened, who really don't have access to that first home. And you think about the rental population, 70% of renters are cost burden. Now, in other words, there's no savings, there's no margin in order to kind of get into the system. So that's on the margins. And then when we think about that 30% AMI and below, which is an increasing number, and also, which is, I agree with Dr. Frost, the disaggregation really shows that a lot of this is associated with race. This is the imperative for equity. This is imperative for an inclusive prosperity, and unfortunately, the trends are getting worse, particularly with COVID, which has not been kind to this disparity. So how do we unlock this? It is supply and demand. It is attracting more developers, attracting more capital, more subsidy. But also, I think that many times on a municipal level, there are tools, and I think that's what this task force has really helped kind of open up the conversation of bringing innovation and ways to think about it as more than just subsidy to get where we need to go. There's many housing advocates, and of course, there'll be at the Capitol and they'll be in Washington. But the actual issue that in Minnesota that it's worse than any other community is kind of our community shame. And I think we now are looking at it clear-eyed will give us an opportunity to address it.
One of the things that was pointed out in the dashboard is that the racial disparity gap around homeownership. So the 70% is not at all the reality for BIPOC residents of Minnesota. And we have to double to even meet the national average, much less succeed. Tom, as a lender, can you talk about where are you seeing this play out? Where are our current strategies or products, lending products working? Where are they not? What needs to change?
Yeah. I think we've learned a lot since the last financial crisis, in that the view isn't let's lower the bar to just allow people to borrow more than they possibly can afford and to get into a home. The view is really around sustainable home ownership, and one of the things that we really see, and I participate not only obviously in our own mortgage business, but with national groups trying to address this on a national level, is that for prospective homeowners, particularly African Americans, and especially in communities where homeownership hasn't been the norm, a lot of the issue comes down into education and awareness. It comes down to having people in the community who can really talk to the opportunity of owning a home, what it means to own a home, not just qualify for a mortgage, but actually own a home, be able to afford the payments on a regular basis. So our thoughts really gone into, from a lending perspective, that education, connecting in the community, building within the community loan officers, people of color in those communities who could work with those individuals. So really trying to take a comprehensive approach around education, awareness, the value of homeownership and what it takes to maintain homeownership. That really then complements the other work that's going on to try to address the supply issue.
Dr. Frost, you talked about experiencing sort of on the ground and as a doctor, people who are in need of housing. Can you talk about how that shows up amongst your patients and what are some of the intersections you see?
Yeah, certainly, Stephanie. That's a great question. Perhaps the best way to illustrate that connection between housing affordability and health might be for me to share an experience that I had recently in caring for a patient. That patient's name is Jessica, and Jessica is a single mom that I recently admitted to the hospital with severe COVID pneumonia. And notable about Jessica's medical history were two things. First of all, morbid obesity, and secondly, poorly controlled diabetes, both of which we know to be independent risk factors for serious COVID complications, and therefore they were likely responsible in large part for her presentation with severe COVID pneumonia. And notable about Jessica's social history is the fact that she works 2 minimum wage jobs and lives in a 2-bedroom apartment with her children, as well as 2 other adult family members. And in talking to me about this, she was almost apologetic about how her social situation had created the conditions responsible for her hospitalization. She talked first to me about her overcrowded living conditions and how she knew that when her son became sick with COVID, it was going to be virtually impossible for her to isolate him from others in the household, and that she thus herself was likely to become infected. And then she told me that after paying for rent and utilities every month, she often had little left over for anything else, including healthy food. And this is a source of constant anxiety and frustration for Jessica, because she realizes that her need to prioritize housing stability over a healthy diet is directly responsible for her obesity, which in turn contributed to her developing diabetes several years ago. So after getting to know Jessica, it was clear to me that she's a person who sincerely wants to improve her health by losing weight and controlling her blood sugars, yet that threat of housing instability created by her limited financial means has made this effectively impossible. And if all of that was not challenging enough, she also is sincerely interested in establishing a regular exercise routine, which would help to control her weight as well as her diabetes. But she lives in a neighborhood that's lacking of safe and easily accessible recreation spaces and outdoor walking spaces, which further complicates her housing situation and its negative effect on her health and well-being. So this is a pretty common story, unfortunately, at Regents Hospital, and I regularly take care of patients whose social circumstances have determined that they will be chronically unhealthy. And unfortunately, furthermore, the traditional healthcare system really has limited direct ability to prevent these unhealthy situations and control them once they develop, a fact that we know to be true based on social science, which has taught us that only 10 to 20% of modifiable contributors to health outcomes of a population are attributable to medical care delivered through the healthcare system. The other 80 to 90% of contributors to health are broadly referred to as social determinants of health and include health-related behaviors, environmental factors, and socioeconomic considerations, of which housing stability is a specifically well-researched factor. In fact, recent reviews of published literature about investments to address social determinants of health suggest that those focused on housing support rank among the highest in terms of ability to drive positive health outcomes, especially related to conditions such as obesity, illnesses such as diabetes, and utilization of healthcare resources, such as emergency department visits and hospitalizations. So I think my take-home message is that lack of access to affordable housing commonly forces people with limited financial means into unhealthy living conditions, and frequently, furthermore, unfortunately, forces them to make tough decisions to forego other basic necessities of life that are required for optimum health and well-being.
So we have some follow-up questions from guests on that. So this is obviously a link that you're seeing and seeing documented research. Do you find the conversation shifting to include this more around healthcare providers? And maybe the even more important question are that you talked about the limited tools at your disposal. Are there resources that can or should be shifted or linked better between health and housing?
Yeah, so the first part of your question, most definitely there's an increased focus in the healthcare industry, certainly on social determinants of health. And so we're engaged at HealthPartners, and I know all of the other healthcare systems in the state are also engaged in seeking out new strategies, building and deploying those new strategies to identify health-related social needs. And then after identifying those, looking at strategies to link patients with community-based resources to help address those needs or remedy those needs and close those gaps. So I think that addresses the first part of your question, Stephanie. If I recall correctly, the second part of your question, it was related to tools available to healthcare.
Tools or resources to either link or shift some of that investment more upstream.
Yeah. So this is kind of a novel area for healthcare. The tools that exist today may not be as broad as tools that exist and are available to us to address other things that we've been doing for decades now. But there are tools that exist. There are capabilities to assist with linkage of healthcare records and the electronic healthcare medical record, to identification of community-based resources in one's community. And with increasing frequency, those tools are allowing us to communicate more effectively directly with community-based organizations. So from a resource availability perspective to help facilitate this work, that comes to mind, top of mind. I think those are the particular tools that healthcare is really focused on and interested in these days.
Thank you. And to all the panelists, please feel free to jump in any point and go back and forth, because I think this question of what changes need to be made to the part of the system that you're in and others is important. So what is something else that you'd like to see, Paul?
Well, Stephanie, I was just going to chime in on that. There's been an interesting pilot going on at the state of Minnesota with supportive services for folks who are in deeply affordable housing. And it really involves a shift to Medicaid, tapping into Medicaid funding to pay for the services for the folks living in supportive housing in particular. And that, of course, that has had its rough patches here as we've tried to figure out how to make that work. Healthcare funding obviously is very complicated, and all the compliance and the eligibility and so forth has been a pretty heavy lift. But it is an exciting opportunity to better tap into healthcare funding for housing, not necessarily for the bricks and mortar, but Dr. Frost, I mean, every hospital in any urban core city, and even in greater Minnesota and rural areas, sees that they are the housing of last resort, right, for folks who really are in tough situations. And I think that the multiple pandemics that we've seen here in the last couple of years have only amplified, right, the fact that housing is healthcare. If you didn't have stable housing in this last couple of years, you in fact were at risk of catching this virus and dying, right? Housing is education. We are educating our kids from home again in this most recent surge, right? Housing is employment and training and all. I mean, if you didn't have a stable place to be, you couldn't access virtual training. And so I think there's a whole shift in certainly healthcare is a big area, but in multiple sectors where we are seeing how fundamental housing is, stable housing, to so many different areas of life and prosperity and vitality for households. And ultimately, I think it's a workforce issue. If we desperately need every worker we can get, if we can't stably house folks and solve that patient's situation right on the front end that Dr. Frost was referring to, we've lost a worker. And that has everything to do with economic vitality in this region, and I would argue across the country.
I'd love to talk about some of those regional differences. One of the questions that came out is what makes this dashboard different? I know one of the things it adds is that regional comparison and the spatial comparison within the region. So I'd love to go to Tom and Charlie. Tom, if you could start sort of using the fact that you're calling them from somewhere outside of Minneapolis, what do you see that's particular to the Minneapolis-St. Paul region? What's different as you look across the country? And then within the metro, Charlie, if you could talk about some of those spatial differences and how we think about them. Tom?
Sure. Well, I think I'd start off with, and this plays on something Paul said, is, housing and home ownership has really been, front of mind with people through the pandemic. As you said, it's where kids are being educated. It's where a lot of people are working from right now, if not full time, at least on a fairly regular basis. So we've seen, large increase in home prices really across the country, and a shift in what people are looking for homes as well. So they're looking for more space outside, as well as the house itself. When I think about Minneapolis versus what I see in the rest of the country, one of the things I start with is, and I think this shows up in the dashboard, there are a lot of really strong positives about Minneapolis, and I'm going to applaud you for jumping in at this point in time and recognizing, as strong as the market is in so many ways from an affordability standpoint. I look at things like low delinquency rates and low decline rates, on applications. There are gaps to close as well, and so jumping at this point in time, I think is really forward thinking of all of you. And so building off those strengths, thinking about how you make it strong for everybody. We talked about, the equality side of the equation on home ownership. And I think there are opportunities to really start to close that gap on home ownership. Fortunately, you're not doing it from a really high level of home prices. There's still a lot of affordable units within Minneapolis, and really focusing on what does it take to expose that opportunity to, a broader audience, to bring in, those people who have missed out on the opportunity to date, and help educate them on, what it means to be a homeowner and bring them into the fold there. So, for as many, challenges you have, I think I'd start with saying that, you're starting from a position of strength, and the focus now should be on, those areas that still need to be brought up and close the gap with, and the different ways to do that.
Well, I'll jump in, and Tom, there's nothing more gratifying than hearing an outsider talk lovingly about our community. So thank you. But I actually, getting to the point within the metro, that location does matter. There's no question. And one of the things we certainly study at the Metropolitan Council, and it relates in a lot of different areas of our planning, is we, talk about concentrated areas of poverty. We also are studying concentrated areas of affluence. How is it we have these legacy areas that do well, and what's going on there, and what are the restrictive covenants? And that this goes back to, decades ago, but some of that legacy remains. And we think about affordability, not just in terms of housing costs, but I'll have to just get in the cost of transportation. It's remarkable how we've seen housing development along our transit corridors. That means you have households with one car instead of two, or maybe no cars. I mean, that is a huge cost burden. And I think that what we've seen is, just the Green Line extension. We have $1.6 billion of development that has already been completed or is under construction, which just shows kind of where the market is going in terms of what people really require. And the other thing, and I will just kind of responding to a comment in the chat about NOAA, how do you maintain the affordable housing stock that we've got? And we also think about that in the blue line going through North Minneapolis. One of the risks of bringing big government infrastructure in is we'll bring economic prosperity, and we could very readily displace a lot of those affordable, unsubsidized units. And so as we think about the prospect of displacement, rather than jump to a tool, we're embarking along with Hennepin County on really studying deeply what are the factors involved, what kind of solutions we can bring. So part of the challenge is to retain what we have, which is every year we're losing. So I think that location and how the dynamics of the entire metro, and which is gratifying, I think, now that there is no kind of inner city and then there's everybody else. This is a shared concern, and there's a housing choice of that various different income levels. It should be across the entire metro.
And Stephanie, if I can kind of tag on to the end of Charlie's comments there around retain, because one of the opportunities I really see in Minneapolis, and this applies to a number of cities where there's some older housing stock, is that certainly we don't want to wipe out the homes, but we also want to be able to renovate the homes. And in particular, in those lower priced homes, oftentimes somebody gets into it and they need to have repairs. And so one of the focuses we've had is on products that we can bring to the market that not only will allow them to buy the home, but to add on and do renovations, the renovation work to deal with the roof that may need to be repaired, or weatherization, particularly in a place like Minneapolis that could be so important to cost of utilities in winter months and things like that. So the focus from a product perspective isn't really, as I said earlier, around just trying to expand out the guidelines and bring in people at higher debt to income ratios, things like that. But how do we, create products that could really help improve the house, improve the cost of ownership, and take out of the equation, some risk that may be there from having to do repairs, after the fact when you get in the home that you don't have the money for.
Yeah, I might add also, Tom, that those renovations can address unhealthy infrastructure in those homes as well, right? Lead-based paint, asbestos, mold, etc. So when we talk about the health and well-being implications of housing instability, it's not simply about housing affordability. It's about the infrastructure and the unhealthy things that are inside of some of this existing housing that we have.
One of this, with Itasca Project leaning in, Itasca is leaning in as a group of employers. How do we think about this as not just a cost of housing challenge, but as an income challenge? Where does that vary by race? And what's the role employers have to play, particularly in an inflationary environment? How do we link all of these? Paul and anyone really feel free to jump in on this. I think it's a core question.
Yeah, well, that third recommendation within the Itasca working group really spoke to the role of employers. And, one of the things is we at PPL talk to a lot of different private sector folks and employers. And part of the discussion in the Itasca working group was, let's start with just you as an employer looking at the real experience of your employees, right? Because when you really look at the housing experience of your employees, you in fact will see the wide range, especially if you've got any direct service workers, kind of your lowest paid workers, you will see the housing struggle in your own organization. And so I think we've had a little bit of a kind of an insulation that, well, that's somebody else's problem, or that's the problem that's over in that community, not in my organization. And in fact, I'm really happy to see Itasca suggesting to employers, just take a look, start at home, take a look at your own employee base as a way of understanding the housing challenge, because those housing challenges are there for a lot of folks. We have an income problem across this country, right? We will not build our way out of this problem. Supply matters a ton. We have to accelerate and take supply to scale. We also have an income problem. People do not make enough money to afford even the basics, right, of housing. And housing is the largest cost factor in any household budget. It dwarfs, you can add food and transportation, everything else together. Housing is that big of a deal in every household. And so we have to figure out, so rental assistance and some of the big conversations happening in our community about income supports and increased rental assistance, those are all really important and need to be kind of parallel strategies alongside the production and supply side of the equation. And that in fact does start with employers and what are we paying people?
Well, I just jump in to say, when we're building transit systems, we're talking about not access to jobs, we're talking about access to employees. And I know this as an employer at my business, Jefferson Lines. For years, I see technicians, bus drivers having their homes farther and farther out from the metro, drive till you could afford it. Well, we actually started worrying about bus drivers commuting, into Minneapolis to drive a bus, 10 hours. And as a safety point of view, it's kind of an odd thing that over time, even that has broken down. That doesn't work anymore.
So as we think about the scale of this challenge, which is something we've talked about a lot, and the multifaceted approaches that are important to meet it, is there one thing that either your organization can be doing differently, or a partner or someone along the spectrum, something you think needs to change? So taking a hard look at our own practices and decisions, and what are the barriers that are put up by other players? I will start with Tom on this one, but all of you, I'd love to hear.
Yeah, thanks, Stephanie. And, I would like to mention, one of the things we're doing within US Bank and within our home lending area, which we call the Access Home Commitment. Minneapolis is one of 5 markets we've identified to specifically focus on, closing that homeownership gap with African Americans. And part of that, commitment is, working with community groups. We've identified a set of community groups to really get out that education message I talked about earlier. It's a commitment to hire within the communities. So there's a commitment around hiring Black loan officers, actually people without experience, because we find there's a lack of people with experience, and taking them through, training program. And also an area that's gotten a lot of attention lately that we're very focused on as well is the appraisal issue within communities where it's hard to get the appraisals to match up with where they're coming out in the white community versus the Black community, and what that means for the ability to get a home and share in that wealth appreciation. So we have a commitment as well around again, hiring people, training them to become appraisers. So it's that overall education. It's hiring in the communities, connecting with the communities, as well as the products that we bring to bear. And happy to say Minneapolis is one of the core markets where we've launched this. Really looking forward to kind of tracking with the dashboard here on the efforts that we're doing and helping to target our efforts. But we know it's a long-term a problem that's been out there, and it's going to take years to really solve it. And one of the things I've actually liked seeing in the dashboard was the goal around closing that Black homeownership gap, but setting a goal that isn't overly ambitious as well. I think we really need to start at a level that we can see tangibly making progress, and so I think that all ties really well together with the work that we have going on. The dashboard ties together well with the work we have going on trying to close that gap.
Stephanie, as opposed to maybe one thing the healthcare industry could do, I kind of think of one thing maybe the healthcare industry has to be careful that it does not do, insofar as how it is able to assist with this issue, and that is we have to be careful in healthcare of not medicalizing social determinants of health. And what I mean by that is, as healthcare becomes increasingly involved in seeking to identify and then remedy health-related social needs, we run the risk, I think, of confusing those social needs with the social determinants that actually drove those needs, and conflating health with healthcare, which would be risky and potentially give credence to a fallacy that societal problems having to do with health primarily need healthcare solutions. If we were to do that, I think we run the risk of potentially redefining social determinants to be mostly or only about the immediate needs of the immediate social needs, health-related social needs of individual patients. And I think that could only potentially make it more difficult to think about how to properly invest in solutions to address these issues.
And Stephanie, I just wanted to chime in on this question. I think it's a really good one. For us at PPL, we are the fundamental thing that we're trying to do differently actually goes back to one of the earliest questions that was asked in the chat about who's involved in the decision making. And for us, who builds and how we build matters as much as what we build. And when I say that, what I mean is, Tom was referencing this in terms of hiring more people from communities that are impacted by these issues, right? For us, figuring out how to use PPL as a partner with community, right? So we're working with small Black developers, helping to strengthen their skills and capacities, and using our balance sheet and some of our leverage and relationships to actually figure out some different pathways for BIPOC developers, right, to get into the work of development, right? And how we engage with community, right? In more extensive, we're working with another large bank in town here on Lake Street on rebuilding the Lake and Nicollet site that was burned as part of the in the social unrest, and having a very different process and conversation with community about, hey, what should this look like, right? What are the possibilities here, and how can we make this the centerpiece of a larger neighborhood economic opportunity, right? Including home ownership, including spaces for Black entrepreneurs, including spaces for green space and community gathering spaces. So who builds and how we build matters a lot. And that's something that we're trying to really think about very differently here at PPL.
You know, I just jump in and pick up where Paul left off. You know, you think about Metropolitan Council, we're involved in so many separate, discrete parts of this puzzle. But I think of building out the B line along Lake Street. It's not just about moving people, it's placemaking. It's part of the resurgence economic development to retain the vibrancy of a neighborhood. And I think the challenge for us at Met Council is to not be so siloed, that we need, and we are working now about the holistic goals of where does transportation, where does comprehensive planning, where does housing, the tools and leverage that we have kind of work in an interconnected way toward larger goals that we will do with local governments, with the private sector, and with people such as are on this panel. So great honor to be here today. And I know we're wrapping up, but thanks for the opportunity.
And thanks to you all. I think one of the things that's been highlighted throughout this conversation and on the dashboard is the scale and complexity of the challenge and the role that so many people and so many different organizations and governments need to play to really address it. So these are high level goals because there are so many different players that need to act in those. Thank you all of you for joining. I know that Libby has shared the link in the chat and you can watch your email if you registered to receive both the link and the recording for this session. Really appreciate all the work that went into this, the panelists today, and everyone who was able to join the session. I hope you have a wonderful day.